Welcome to 4 Dharma Turn, your guide to unlocking your brain's full potential. Today, we'll explore the dynamic relationship between neuroplasticity and learning, revealing how the brain adapts and evolves with new knowledge and experiences. Join us as we delve into the science behind how we learn and how this understanding can empower lifelong personal growth. Neuroplasticity, or neuroplasticity, refers to the brain's ability to reorganize and modify its structure and function throughout life. This phenomenon, one of the most revolutionary discoveries in modern neuroscience, is central to learning, as it allows the brain to adapt and incorporate new knowledge and skills in response to different stimuli and experiences. This chapter deeply explores how neuroplasticity serves as the basis for learning, offering a detailed understanding of how our experiences, practices, and environments shape our minds. The human brain is made up of approximately 86 billion neurons, which communicate with each other through synapses, forming complex neural networks. Traditionally, it was believed that the adult brain was a relatively fixed structure with little change after early development, and that the capacity for forming new neural connections decreased dramatically after childhood. This concept, known as the dogma of stability, has been profoundly challenged by recent studies demonstrating the brain's ongoing ability to adapt throughout life. Neuroplasticity manifests in various ways, including the creation of new synapses, synaptogenesis, the modification of the strength of existing synapses, long-term potentiation and long-term depression, and, in more extreme cases, the reorganization of entire brain areas in response to new demands or injury. For example, in individuals who have lost their vision, areas of the brain initially dedicated to visual processing can be recruited to process other types of information, such as sounds or touch, demonstrating a remarkable capacity for adaptation. One of the leading theories explaining how neuroplasticity is involved in learning is the Hebbian theory, proposed by Donald Hebb in the 1940s. According to Hebb, neurons that fire together wire together. This principle describes how the repeated coactivation of neurons strengthens the synapses, creating more efficient neural networks. This mechanism is fundamental to learning, as it facilitates the formation of neural circuits that encode new knowledge and skills. A classic example of how Hebbian neuroplasticity works is associative learning, as in the case of Pavlovian conditioning. When a dog hears a bell, a neutral stimulus, shortly before being given food, an unconditioned stimulus that naturally triggers salivation, the neurons that respond to the sound and those that react to the sight or smell of food begin to associate. Over time, the sound of the bell can trigger salivation because the synapses between these two sets of neurons have been strengthened through repeated experience. Learning is a passive process of absorbing information and an active and dynamic brain remodeling. When we learn something new, such as playing a musical instrument, riding a bike, or learning a new language, the brain creates new synapses, the connections between neurons, or strengthens existing ones. This process, known as synaptogenesis, is essential for retaining information and acquiring new skills. Repeated practice is crucial for this process of synaptic remodeling. Repetition strengthens synaptic connections, consolidating memory and making neural networks more robust. Practice spread out over time, known as spaced practice, is especially effective in promoting lasting neuroplastic changes. The brain needs time to consolidate new information between practice sessions, resulting in deeper, more lasting learning. In addition, motor learning, such as learning to play the piano or playing sports, leads to the restructuring of motor areas of the brain, such as the motor cortex. Studies of pianists show that those who practice regularly have increased gray matter density in brain areas associated with fine motor control. This illustrates how practice improves skill and transforms the brain structure. A fascinating feature of neuroplasticity is its dependence on experience. The brain does not change randomly. It responds to our experiences, whether we are learning a new skill, navigating a complex environment, or even interacting socially. This type of neuroplasticity, known as experience-dependent neuroplasticity, explains why individuals develop different skills and knowledge throughout their lives. For example, professional musicians have more excellent cortical representation in the areas of the brain that control the fingers. This adaptation reflects the intensive and repeated practice of playing an instrument. This phenomenon is also observed in taxi drivers, who often have a more developed hippocampus, an area of the brain involved in spatial navigation, due to years of practice navigating the streets of a complex city. Another intriguing example is second language learning in childhood versus adulthood. Although adults can also learn new languages, the underlying neuroplastic mechanisms are different and often less efficient. This may explain why they have more difficulty achieving fluency comparable to native speakers. Experience-dependent neuroplasticity is an ongoing process shaped by the physical environment and social, cultural, and emotional interactions, demonstrating the interconnectedness between the brain and the external world. While neuroplasticity is most pronounced during childhood, the adult brain exhibits significant plasticity throughout life. Adult learning involves the creation of new synapses and pruning redundant neural connections, a process known as synaptic pruning. This means the adult brain can adapt and reconfigure itself to acquire new skills or recover from damage, albeit more slowly than in childhood. Studies have shown that adults who engage in cognitively challenging activities, such as learning a new language, practicing a musical instrument, or solving complex puzzles, experience measurable changes in brain structure and function. For example, a study of older adults who learned to play the piano over 6 months showed increased gray matter and improved working memory. These findings suggest that, even in old age, the brain can reconfigure and adapt. Furthermore, synaptic plasticity is crucial for recovery after brain injuries such as a stroke. After a stroke, areas of the brain adjacent to the injury can take over lost functions, a process known as neural recruitment. Rehabilitation therapies are often based on this principle, using repetitive practice to stimulate the reorganization and strengthening of neural connections, facilitating the recovery of function. Emotions play a vital role in learning and neuroplasticity. Emotionally charged experiences tend to be more memorable. They can accelerate the learning process by increasing the release of neurotransmitters, such as dopamine and norepinephrine, which are associated with enhanced memory, attention, and motivation. This is because emotions help prioritize information, increasing the likelihood of storing it in long-term memory. Studies with students show that content taught in contexts that evoke emotions, such as excitement or surprise, is better retained than content presented neutrally. Furthermore, negative emotions, such as fear or anxiety, can also influence learning, often in detrimental ways. Stress can impair the ability to concentrate and assimilate new information. Understanding the impact of emotions on learning has led to developing pedagogical approaches that seek to create emotionally positive and safe learning environments. Stories, gamification, and project-based learning can emotionally engage students, facilitating understanding and promoting neuroplasticity. Understanding neuroplasticity has significant practical implications in formal education and personal development. Teaching methods stimulating brain plasticity, such as active learning, spaced practice, and immediate feedback, can significantly improve educational outcomes. For example, spaced practice, where study sessions are spread over time, is more effective than cramming because it allows the brain to consolidate and reinforce new information. In addition, personalizing instruction to consider individual differences in brain plasticity can help maximize learning potential. This can include using adaptive technology, such as educational software, that adjusts to the student's skill level, offering challenges appropriate to their current ability, and encouraging cognitive growth. Another field in which neuroplasticity has shown great potential is neuropsychological rehabilitation. Techniques such as occupational therapy, cognitive behavioral therapy, CBT, and mindfulness meditation have positively affected neuroplasticity, promoting mental and emotional resilience. These practices help recover lost functions and facilitate the development of new skills, contributing to a better quality of life. The growing body of knowledge about neuroplasticity offers a promising vision of the future of learning and human development. As science unravels the precise mechanisms of brain plasticity, new educational and therapeutic approaches may be developed to optimize human potential. This includes using advanced technologies such as neurofeedback, transcranial magnetic stimulation, TMS, and brain-computer interfaces, potentially accelerating learning and the recovery of brain functions. Furthermore, the recognition that neuroplasticity is influenced by environmental, emotional, and social factors underscores the importance of creating enriching learning environments that impart knowledge and cultivate curiosity, creativity, and intrinsic motivation. Neuroplasticity is the foundation upon which learning is built. By understanding how the brain adapts to new knowledge, we can adopt practices that enhance this capacity, promoting continuous and adaptive development throughout life. The science of neuroplasticity offers us a clear picture of how we learn and the promise that we can constantly reconfigure our minds and expand our abilities, regardless of age. This understanding transforms our view of human potential, challenging the notion that our capacities are static or limited. Instead, it suggests that we can shape our minds to achieve higher levels of competence and understanding through conscious effort and intentional practice. Neuroplasticity is not just a scientific concept, but a powerful tool for personal transformation and continuous growth. Stroke patients often experience loss of motor, sensory, or cognitive functions due to damage to specific brain areas. Post-stroke rehabilitation is based on the principles of neuroplasticity to help patients recover these functions by exploiting the brain's ability to reorganize its neural networks in response to repeated stimuli and experiences. Motor rehabilitation is a significant focus, where constraint-induced movement therapy, CIMT, is used. In CIMT, the healthy limb is restricted, forcing the use of the affected limb and thus promoting the reorganization of the neural pathways responsible for movement. This practice has shown significant results in recovering lost motor functions, demonstrating how neuroplasticity can be harnessed to restore functional independence to patients. Another emerging technique in post-stroke rehabilitation is virtual reality, VR. VR creates simulated environments where patients can practice specific movements and activities in a controlled and immersive context. This approach makes therapy more engaging and allows for intensive task repetition, which is crucial for inducing synaptic plasticity and cortical reorganization. Studies have shown that VR can improve motor and cognitive recovery, accelerating the return to daily activities and increasing patients' quality of life. In addition to these approaches, post-stroke rehabilitation often incorporates occupational and speech therapy to address deficits in other areas, such as language and cognitive skills. Early and intensive intervention, aligned with the principles of neuroplasticity, is essential to maximize functional recovery and minimize long-term sequelae. Cognitive behavioral therapy, CBT, is a widely recognized form of psychotherapy that aims to modify dysfunctional patterns of thinking and behavior. What makes CBT particularly relevant to neuroplasticity is its ability to induce lasting changes in the brain. Through techniques such as cognitive restructuring and gradual exposure to feared situations, CBT can reshape the neural networks involved in emotional regulation and stress response. Neuroimaging studies have shown that CBT can reduce activity in the amygdala, a brain structure involved in the response to fear and stress, and strengthen connections between the prefrontal cortex and other brain areas. These changes indicate a reconfiguration of neural networks, demonstrating that psychological interventions can literally rewire the brain, promoting better emotional regulation and reducing symptoms of disorders such as anxiety and depression. The effectiveness of CBT is particularly notable in conditions such as post-traumatic stress disorder, PTSD, where intrusive thought patterns and amygdala hyperactivity can be reduced through exposure and desensitization techniques. The neuroplasticity induced by CBT not only improves symptoms, but also promotes mental resilience, equipping patients with tools to deal with future emotional challenges. Non-invasive brain stimulation has emerged as a promising tool for inducing neuroplasticity in specific brain areas. Techniques such as transcranial magnetic stimulation, TMS, and transcranial direct current stimulation, TDCS, modulate neuronal activity, facilitating the reorganization of neural networks. TMS uses magnetic fields to induce electrical currents in targeted brain regions, which can increase or decrease neuronal excitability. This technique has shown efficacy in the treatment of treatment-resistant depression, promoting plastic changes in brain networks involved in mood and cognition. In addition, TMS has been explored as an adjunct in post-stroke rehabilitation, helping to reactivate damaged motor and sensory cortical areas. TDCS, on the other hand, applies a low-intensity electrical current through the skull to modulate cortical excitability. TDCS is used in both research and clinical applications to improve cognition, alleviate chronic pain, and accelerate motor recovery after a stroke. By altering neuronal excitability patterns, TDCS facilitates synaptic plasticity, promoting functional recovery. Combined with traditional therapies, these techniques can enhance the effects of neuroplasticity, offering new possibilities for treating neurological and psychiatric conditions.